More than half of elderly hospital patients discharged to nearly 200 Scottish care homes were not tested for COVID in the early days of the pandemic, according to data obtained by the BBC. The Scottish Government say Public Health Scotland analysis found no clear evidence hospital discharges were associated with care home outbreaks and that this latest data did not change that conclusion. Stephen Godden reports.
88 and suffering from Alzheimer's, Nancy Lovering was recovering in hospital from a chest infection last March when COVID meant her daughter's search for a suitable care home took on a sudden urgency.
It did seem to happen very quickly. All of a sudden it was, we've got to get beds empty, we've got to get people out of here. It doesn't matter where they go, get them into wherever there's a space. It doesn't matter if it's a home that you approve of or agree with, let's just get them out of here.
Untested herself, a place was found for Nancy at this home in Crieff.
Mum was straight away in 14 days isolation, and that was when it really started to sort of hit home, you know. So then I didn't see her then for 14 days, and I didn't see her then again until she went back into hospital and she was near death.
Nancy's story fits an acknowledged pattern during those early weeks of the pandemic. Elderly patients discharged into care homes to free up hospital space, many without being tested. What's been missing is detail, until now. 11 months after the BBC first asked for it, Public Health Scotland has released data showing which care homes received the 5,198 elderly patients discharged from hospital between the start of March and the end of May last year. They also show whether or not they'd been tested for COVID. Whether it's this Rutherglen care home where at least 28 of the 40 incoming residents weren't tested, or here in Lass Wade where 5 elderly patients arrived having tested positive, individual examples combine to form a bigger picture.
I think it was shocking to think that there were nearly 200 homes that half of the incoming residents were not tested prior to their being released from hospital. This is at a time when we are being told that our elderly were the most at risk. So what exactly were the hospitals doing?
Ministers have acknowledged that with hindsight, discharging untested patients was a mistake, but say these latest figures don't change the conclusion that there's no clear statistical evidence of a link with COVID outbreaks in care homes. Those running the home where Nancy fell ill say they were following government guidance, a view echoed by other operators in a sector calling for more work to be done.
We need to hear the stories of frontline staff, of managers, of families involved at discharge to get behind the data. The data takes us so far, but we need to go further.
18 months on from losing her mum to COVID, Jo hopes the public inquiry due to begin later this year will bring families like hers some of the answers they're looking for. Stephen Godden reporting, Scotland.